Hi, and welcome to this video on verbal reflection. Today, we're going to define verbal reflection, demonstrate key features of reflection through role play, and highlight how reflection contributes to your practice as a clinician. Reflection is a critical and increasingly mandatory part of our development as registered health professionals, and it's a skill you'll use throughout the entirety of your career. It can be written or verbal, and today our focus is going to be on the skills needed to verbally reflect in an effective fashion. So, what is verbal reflection? Verbal reflection takes place when we proactively discuss a learning experience in a way that analyses and evaluates our actions during that experience, with the aim of improving the knowledge, attitude, and practice that we apply to future learning experiences. So ultimately, regular, effective verbal reflection improves the quality of our practice. When we become effective reflectors, verbally and through writing, we improve the skills we need for everyday practice, like critical thinking, professional and clinical reasoning, and prompt decision making. Several frameworks have been developed to guide reflective practice, and although the pathway of each framework can differ, all frameworks ultimately achieve the same aim, which is to improve the knowledge, attitude, and practice that we apply to future learning experiences. The reflection we're going to discuss today is guided by Kolb's learning cycle. And this cycle has 4 stages. First, experience, where we have a learning experience. Then summarize, where we describe that learning experience. Conceptualize, where we interpret what happened and make connections between elements of the learning experience to develop new ideas for practice going forward. And plan, where we then decide how we're going to integrate our new learning into our future practice in order to become better practitioners. Verbal reflection generally takes place very shortly after a learning experience, such as directly after a client interaction that you've just had. So, since it takes place on the spot, verbal reflection is usually relatively brief. But when used effectively, it's still very valuable for consolidating and advancing your learning as you move through your day. When reflecting, remember to be proactive, where you take the lead on identifying learning situations that will most benefit from reflection. Be authentic, where you avoid saying what you think you're supposed to say, and instead respectfully say what you believe to be true. And move beyond simple description and instead interpret your learning. And you do that by linking your learning situation to what you already know and to what you need to know for the future. Verbal reflection can take place almost anywhere, whether it's in the clinic after a client has just left or in the corridor walking down on the way to see another client. Wherever you do choose to verbally reflect, make sure that you can maintain confidentiality and make sure that you have enough time to address the matter raised. To put this background information into practice, we're now going to watch a role play where a student is reflecting with their educator. As you watch this role play, think of what we've just been discussing and try and identify the elements missing from this reflective conversation.
Oh, hiya.
Hi, how are you?
How did your first initial assessment go?
It went fine. I got to ask all the questions on the assessment form. He reports everything is okay, but he didn't really want to chat to me. He wasn't really interested, but he reports no issues. So I think we can discharge him.
Okay, great. Well, it sounds like a straightforward discharge, which is great. But just because it's your first initial assessment, I suppose maybe we could chat about it for a little bit?
Yeah, okay.
Okay, so tell me exactly what happened when you went up to do the assessment.
So I went up to the ward just before lunchtime and his brother was visiting him at the time.
Okay.
I feel like he was in a bit of a rush, so I flew through the questions on the initial assessment form, which suited me as well because I have a lot on today, but he seemed happy with that too. He reports no issues, he's looking forward to getting home, and I think we can discharge him.
Okay, so from your own assessment, you mentioned there that it was around lunchtime and his brother was visiting. Was there anything else that might have impacted on your initial assessment?
I don't think so. I think he's just really looking forward to getting home. I only focused on the initial assessment form today. I didn't do any other assessments because I feel like there wasn't really much point. He doesn't look like he's going to engage in our service, and the doctor has already cleared him for discharge anyway.
Okay, so what's the outcome for this patient then?
So I'm going to write up the assessment in the medical chart and I'll feed back to the MDT later this week.
Okay, great. And I suppose reflecting back or moving forward here for your own learning, would you do anything differently next time?
I don't think so. One of my goals at the moment is trying to see as many clients as possible, and I think it's important to recognise clients that will benefit from our service and focus on them. Don't you agree?
So, as we can see from that role play, although the student summarised the experience and their thoughts and feelings about that experience quite well, they didn't generate any new learning or make a plan to improve their future practice. So now, let's take a look at a second role play where we'll see a student work through all 4 stages of Kolb's learning cycle. So they're going to have an experience that they summarise, think about in a way that generates new learning, and that they use to create a plan to improve their future practice. Try and identify each of these 4 stages as we watch this video.
Oh, hiya.
Hi.
How did your initial assessment go?
It actually wasn't as straightforward as I thought it was going to be.
Oh.
Would you mind if we discussed it?
Yeah, no problem. I'm on my way to a meeting, but I have a couple of minutes. Is that okay?
Yeah, that's okay.
Great.
Well, when I met the client, he was lying in bed and his brother was in to visit him. It was around lunchtime and the client told me he was hungry. So I thought maybe it wasn't the best time to be doing an assessment with him.
Yeah, you know, it's really challenging to carry out assessments here in an acute setting. It's a challenge for all of us here, really.
Yeah, I think so too. I did the assessment with him anyway and he was able to answer most of my questions, but I feel it was all a bit unclear and a bit rushed. I know the MDT are eager for him to be discharged later this week, but I don't feel I know enough yet to help with that decision.
Yeah, it sounds like you feel like it wasn't a super comprehensive assessment, maybe.
Yeah, I really don't think it was. He was able to answer most of my questions and I could fill in most of the form, but looking back at my notes from college about therapeutic relationships and the impact of the assessment environment makes me feel that I didn't do the assessment in the best way I could.
Okay, so what kind of factors are influencing your decision to make you think that you didn't do a comprehensive assessment?
Well, looking back, it was lunchtime and I knew the client was hungry, so the timing wasn't ideal. His brother was also visiting and this is his only visitor all day, so interrupting that isn't great. I probably should have come back after lunch or asked him if there was a time that suited him better. I also didn't explain my role very clearly to him, and that's something that's really important, especially in a busy acute setting like this.
Yeah, and just for your own learning, why is it really important that we're very clear about what our role is to clients?
Well, I think everyone here wears a uniform, so it can be difficult to distinguish one from another. It's up to me to tell the client who I am and what my role is. Then he'd be aware of the supports available to him here and in the community. If I'd explain my role more clearly to the client, he would have the opportunity to tell me maybe a bit more about his needs in this area.
Okay, great. That all sounds great. So what's the outcome really?
Well, I think on one level I could go ahead and facilitate the discharge of this client, but now after speaking with you, I want to go and see him again and conduct further assessment with him. I can do it in the clinic room this time so there'll be less distractions. I'm also going to make more of an effort to explain my role to him so he can maybe tell me about some goals in this area. I can do it this afternoon and then I can write my notes in the chart and talk about it with the MDT.
Oh, that's super. I think, you know, we're teaching you guys clinical reasoning on this site and you have to be confident behind the clinical decisions that you make. So if you feel you need to gather more information as part of your initial assessment, I think that sounds like a fantastic idea.
Okay, great.
Brilliant.
And hopefully this time I can figure these things out during the assessment rather than afterwards. Would it be okay if we discuss this case further in our next supervision meeting?
Absolutely, that'd be great. I think we're meeting tomorrow.
Yeah.
Okay, super. I'll head to my meeting.
Okay.
See you
great.
later.
Thank you.
Bye.
So from that role play, we can see that the student took the lead with their own learning and initiated the reflection themselves. They worked through all stages of reflection and ultimately came up with a plan that was going to lead to improvements in their future clinical practice. They viewed even a short amount of time as an opportunity to advance their learning, and this is a key part of becoming an independent, effective practitioner. Because verbal reflection tends to happen on the spot and is relatively brief, it can be a little bit more difficult to master when compared to written reflection. This section is going to look at 2 common challenges with verbal reflection, and we'll look at how these can be overcome in practice. Remember that, as we saw from our first role play, novice reflectors can get a little stuck on describing what happened and forget to generate new learning or to make plans. If this happens, use an audio recorder, like a smartphone, to record your verbal reflection. Make sure to ask the person you're speaking with for permission to do this. Listen back and write out your reflection that evening when you have more time to work through your thoughts independently. By reflecting verbally and on paper, each will improve the other. Reflection is especially helpful after situations that we find challenging. When these situations occur, students can sometimes think that if they highlight the difficulties they had in the situation, that it'll make them seem less competent than they would wish. But everyone, whether they're qualified or in training, finds themselves in situations that are difficult to manage. So the issue is not having a difficult situation. The issue is not learning from a situation that you found challenging because you're afraid to draw attention to it. Think back to the second role play. Remember that if reflection is to be effective, the people involved should be authentic. Avoid being overly self-critical and reflect fairly on what happened. To do this, calmly set the scene in a reasonably objective way for your educator and request the opportunity to have a reflective discussion with them so that you can advance your learning. When we do this, rather than seeming incompetent, we actually show our educators that we're in tune with our learning and independently aware of areas where we need to improve. And this is what actually demonstrates our ability to become effective, independent health professionals. A useful activity can be to try and identify some profession-specific barriers to verbal reflection. Have a chat with some of your peers in small groups to try and identify some of these barriers and, as importantly, ways to overcome them. So to sum up, we've had a look at what verbal reflection is, the many advantages of it, and how you can best use it on your placement and in class. Remember to take the lead, be authentic, move beyond description, and enjoy this part of becoming an effective health professional.